Thank you. Well, good afternoon, and thank you all for joining and staying informed. As of this time, there are 5 confirmed COVID cases in Grand Forks County. The virus is here and reinforces the need for us to be vigilant and cautious in the weeks ahead. This will be a marathon, and we need to be prepared for at least another 6 weeks of this way of life. I'm proud of all the work done by the healthcare professionals in our community. They're working around the clock to keep us safe and healthy, and we must do our part and stay home. The virus does not spread itself. We spread it. If we stay home, we avoid getting it and spreading it to others. We've heard of incidents of people in our community not following the guidelines of physical distancing. Grand Forks residents should not be putting their neighbors at risk. This is unacceptable and not representative of who we are. We're a good community that looks out for one another. Stay home, wash your hands, practice good hygiene, and sanitize frequently used surfaces. All citizens taking these measures is the only way Grand Forks will emerge from this pandemic strong and healthy. It's important to continue to be strong and healthy during this new norm of physical distancing. Physical distancing does not mean social isolation. It's imperative. Here's another update. Our city staff is executing the flood action plan. The flood outlook has gone up in the past couple of days, but still within our flood protection project. The crews that do bridge closures will be needed for snow removal later this week due to the upcoming storm, and we expect the water to rise a bit as a result of that. We're being proactive, and our public works crews started closing the Sorley Bridge on Demers Avenue at 1:30 this afternoon in advance of the storm. Please go to grandforksgov.com/flood for information and updates. We've heard a lot of feedback from the community about paying rent and the potential for possible evictions during this time. I do not intend to engage in a regulatory manner at this time regarding private property issues to include rent, eviction, and other contractual matters. I encourage the private sector to continue to be flexible, adaptable, and compassionate in this extraordinary time. Oh, and today is Census Day. If you haven't done it already, make sure you fill out your census. It's even more simple than ever and can be done right on your cell phone. It took me only 5 minutes. Respond to the census today by visiting 2020census.gov. This is the perfect opportunity to check in with your friends and family and make sure they filled one out too. Maybe even make it a contest who can fill out the quickest. We need to count all our people because all of our people count. We're in this together. We'll get through this together, and together we'll emerge stronger than ever. Thank you.
Thank you, Mayor. Next, we'll head over to Dr. Deere from Altru Health System.
Thank you. Good afternoon. As of today, we've seen an increase in our cases in Grand Forks County, as you just heard, up to 5 total. Altru's COVID line continues to be operational with hundreds of calls per day. Our sick clinic remains active, and our other locations are screening all patients and visitors, doing our best to keep clinic environments safe. During this pandemic, we've needed to think how to care differently, particularly with the delivery of care. Due to the ability of our technology team and the creativity of providers, we're now able to offer many ways to connect with our Altru care providers. The primary route of this is through MyChart, and I encourage our patients to sign up on altru.org. Testing continues to be brisk. We're now up to 840 total tests performed at Altru locations as of this morning. 742 are in the Grand Forks, East Grand Forks locations. As of this AM, we continue to have ample supplies, and we have 477 available tests for community use. This pandemic and planning associated with it has allowed Altru to work side by side with our community partners. This includes group homes, nursing homes, senior living centers, the city, county, and state government, and other health systems throughout our care networks and beyond. It's an unprecedented time for collaboration, and we'd like to thank all involved for this. Our focus continues to be what is best for our patients, the community, and our staff. Thank you again.
Thank you, Dr. Deere. We'll head next to first day of school, if you could say, to Dr. Terry Brenner. Dr. Brenner.
Thank you, John. You stole my thunder. Today is the first day of school for our pre-K through 12 students using an online distance learning platform. And again, just to remind the public, the heroic effort that teachers and principals pulled off over the last 7 business days is just remarkable. It's extraordinary, as a matter of fact. This is something that we would have planned for over the course of 2 to 5 years. We planned for this over the course of 2 weeks and have implemented successfully today. We have 7,500 devices out to each of our students. And for those people who didn't have connectivity, internet connectivity at home, we've provided that for them. If somebody out there is still missing some internet connection, we would ask that they contact the district office, because there might be a couple of people who didn't get the survey number 1 or survey number 2. What I will say is this is a new era of education. This is the new normal for the time being. This won't be the new normal forever. We want our students back at the campus level, and students want to be back at the campus level as well. We also know that this has put an extraordinary responsibility and effort on behalf of parents, working parents and parents who aren't working. They've had to create new schedules at home for the teaching and learning process, whether that is for synchronous or asynchronous type learning. We've managed the hiccups today, had a meeting with all of our principals here at 1 o'clock and asked them for some feedback, both positive and what the hiccups might be. And they said, by and large, the feedback they've had from parents is quite remarkably positive. A few of the issues that we've had, maybe families who have 3 or more children, when they're all online at the same time, bandwidth is a problem in their household, and we're going to try to figure out ways to mitigate that for those specific families. So again, this is day 1 of, we don't know how many days we'll be in session like this. We will follow the lead of the governor, but we are watching how COVID-19 is really moving towards the middle of the country. If you look at a map of the United States and you see all the executive orders from governors, it's pretty much everything east of North Dakota and west of North Dakota. And when you look at North Dakota and straight down south, maybe to Texas, those are the states who haven't issued that order yet. So we'll be anxiously awaiting to see what Governor Burgum does and see if that is going to prolong the situation that we're in. All spring activities, which involves co-curricular and extracurricular activities, are on pause. We are following the lead of not only the governor, but the North Dakota High School Activities Association. And so, as I said here before, my heart bleeds for our seniors who were not able to finish a state basketball tournament, or they have not been able to start their spring sport season. With that, just a couple of other highlights. Emily Carl, who is our Director of Child Nutrition, she just on Monday and Tuesday of this week, lunch is served, 1,640 approximately each day. Breakfast served, 1,831 today, and another 1,855 for tomorrow morning. So our families are taking advantage of this tremendous opportunity where we keep our kids fed, and we're really pleased about that. And I just have one plea for the community, those people who are listening, and maybe you can share this with your friends as well. While our school campuses are closed, our playgrounds are closed as well due to COVID-19. Most of our campuses, we don't have fences up to secure playground equipment, so we would just ask the public to remain off the playground equipment. There will be signage up shortly, but it will really be incumbent upon patrons to follow our lead and stay off the playground equipment, as tempting as it is. Get kids outside. So that is the update from the school district, and I will yield the rest of my time to perhaps my colleague, Mr. Gockler, if that's the direction you're going, John.
And you stole my thunder. Yes, Mr. Gockler, we'll have you up next. Mr. Gockler.
Okay, thank you, everyone. So my association here on the panel, I'm the mental health coordinator for the public schools. And the public schools is one of approximately 40 organizations or providers here in Grand Forks that comprise our group now known as Mental Health Matters, which is a Grand Forks community collaborative, obviously around the topic of mental health. So I was asked to come on today and talk about the challenges that our community is dealing with and how to maintain positive mental health during the COVID-19 outbreak. I think probably the best place for me to start is just acknowledging the stress that many people in our community are experiencing. Stress, as we all know, is often brought about by change, by uncertainties, and then specific, stressful situations. And safe to say that Grand Forks is one of communities all across the country that are experiencing that, whether that means for some people less work, other people, maybe the work demands have increased tenfold. Some it's financial stress, some it's academic stress, learning from home in a new environment, possibly health concerns. As Dr. Brenner just alluded to, the grieving doesn't always come from the loss of a loved one. Sometimes it comes from the loss of an event, or whether it's a sporting event or a fine arts event, or something that people have trained for some time. And I think instead of dwelling on the stress and the stressors, I think it's important to acknowledge them, but at the same time to pivot a little bit and talk about how do we address mental health in face of these challenges and cope with these challenges. So I've shared a resource, and it's on our Grand Forks Schools website under our mental health hub that I put together for today's panel. It's just a simple 6-step process. I don't want to oversimplify things. Mayor Brown, you alluded to some of these very things in your opening address. I'll start with just finding reliable information. That's step one. And the city has done a great job on the Grand Forks Gov site with links to public health and then resources for the community, whether it be food resources, utility resources, business resources. That's all important for people to have reliable information right now. I mentioned the Mental Health Hub. Like I said, it's at gfschools.org, Mental Health Hub. I've assembled probably a dozen different resources there specific to COVID-19. Everything from how to nurture your well-being when you're working in isolation at home, to staying resilient during times like this, how to talk to kids that maybe have their concerns, and then just how to care for your mental health in the face of uncertainty.